Hey everyone, I'm Aaron Potratz.
And I'm Nathan Hawkins.
We are the Shrink
Shrink
Think
Think Podcast,
Podcast.
baby.
Enjoy the show.
I'm just kidding, of course. Aaron is totally Metro.
Hey everyone, welcome to the Shrink. You just ruined that.
I didn't know you hit it.
Hey everyone, welcome to the Shrink Think Podcast. We are thrilled, excited. Nathan is especially riveted to be here today. We've got an interesting subject. We talk a lot about things that are helpful for your everyday life, for your relationships, but we also want to bridge the gap between clients and therapists in the therapy world, because that's what the Shrink Think Podcast is really ultimately all about. And so I was talking with some people about therapy, and they were like, I think most of the population, most people that go, have no idea how to evaluate the quality of their therapy. Or the therapist maybe is kind of another way of saying that as well. Like, what's happening behind those closed doors? It's kind of like you go in, you talk about some stuff, you leave, and then it's like, what happened? Like, we talked. Okay, yeah. So are you getting better? I mean, you've been going in there for the last 7 years, right? You're now in your 60s. What's happening?
How old is your therapist?
right, exactly. So like how do you even know if what you're doing is beneficial? I mean, obviously some of it is like, are you feeling better? Are some of your issues improving in some ways? But like, how do you actually know if what's happening in the room is good, is effective? So we want to open that discussion up today and give you some insights, some behind the scenes tips, tricks, things to look for. And this is great for if you're the general population, you're going to therapy, you're just a average Joe listener, because we want you to know, like, how can you be best equipped to go into your next therapy session, right, informed and equipped to kind of evaluate, like, is this really giving me what I want it to be giving me? No doubt you can talk to somebody and that feels good, but is it actually getting you to where you need to be? And then it's also, we definitely want to help the therapy community, the people that are therapists, to do a better job, to do the best job that they can do. And I would even say, I guess from my standpoint, I'd say I would hope that people who are not doing this are convicted or are weeded out, because they're really not helping people. And that's not because they have bad intentions or they're malicious. It's just simply because they're not doing some of the things they need to be doing in order to actually help people get better. That's what therapy is all about. So with that...
Yeah, and I don't think they're trying to do something bad either, just to put that out there. So years ago, one of my colleagues was sharing this. I don't know. It was a recording of Adam Sandler doing a therapy session. It was hilarious. I'm not gonna, obviously, I don't remember the entire thing. I want to give you the gist though, because it kind of highlights a little bit of where we're going, what might be bad therapy. So Adam Sandler sits down and the counselor goes, "Oh, how are you doing? What's going on today?" And he's like, "Yeah, well, I wanted to talk to you because I'm thinking with the holidays coming up that I'm gonna take a little break." She's like, "Oh, really? So you've had some anxiety around your family. Do you think that's the best move?" And he's like, "Actually, it's been helpful to work through some of this. So, yeah, I think it's a good test." And she's like, "Oh, when did you decide this?" And this keeps escalating to where what ends up happening is it gets to the place where the therapist is like, "Well, I just don't think that that's the best move for you. What do you think? What's your plan to come back in here in case this fails?" And he's like, "Well, I think it's going to be okay." And she's like, she gets up to where she's like, "Well, I don't know if this is going to work for me." And Adam Sandler's going like, "It's okay." Everything slowly switches over. He's like, "You know what? We can talk about it later if you want to. You can call me to see. We'll schedule a session and I'll be there for you." It moves. It's like a 30-minute thing, and it's so subtle. It's like brilliant how they switch it around. Obviously, that's bad. You don't want to go in and be helping the therapist. I think everybody kind of knows that. But what you do need to know, like as far as from a client perspective, is you have to actually do this thing called get somewhere. Like if you think of it very simply, therapy actually is a product that you are purchasing, and then something's supposed to happen. And I think a lot of times, I mean, all of us therapists are trained to try to help you, and we we definitely do not like to be think of ourselves as something to be consumed, so to speak, to be able to be used or whatever. However, as you are interacting, I mean, you should be getting something out of it, right? That's kind of the whole point. And then therefore lies the issue, right? Because this is totally subjective. Everybody needs a different thing. Some people need, and I'm not going to go into all the needs, but just to give some examples, it can be crucial for some people to actually get a diagnosis. They need that. They need to understand what's going on. The protocol needs, and it's actually probably the bigger issue of because they don't know what's happening. Then you got other people don't ever want a diagnosis, and the therapist would agree that probably is not the biggest deal. You just need to figure your life out, that kind of thing. A key factor is, can the therapist recognize what's going on? Do they know what's happening? And can they adjust to what you're saying as a client that you actually need?
So, for example, the way therapy typically goes is you meet with somebody, and in the first couple of sessions, the first, 1 or 2, maybe 3 sessions, they are performing an assessment or an initial evaluation to try to gather information and understand what's going on, so they have a pretty good understanding of the nature of the problem, so that they can determine, oh, I think this is a likely diagnosis. Now, whether they, tell you, like you guys are open about that, or in their own head, they're like, I think this is probably what's going on, right? They need to pinpoint, this is the issue, or these are the issues going on that we need to be treating and working on in therapy. And then a therapist will develop a treatment plan, or they will follow a treatment plan of, these are the things that we're going to do in order to make progress on those problems. And hopefully the outcome would be, over the course of, X number of sessions, or months and years, depending on the nature of the issue, you make progress, and you actually can see that those initial problems have dissipated and those symptoms have disappeared, right? And the person has much more skills and capability in dealing with the things that they need to deal with, that they were having troubles with before. So in the first couple of sessions, what you're saying, Nathan, is that a therapist needs to be hearing all of the things that are going on and accurately understanding what's happening. And that doesn't mean they're going to gather everything. They might miss something, or you might later on realize there's a piece of the puzzle that needs to be brought in. But in that first couple of sessions, a good quality therapist is going to accurately understand what's going on. So you, as a client, if you were the one sharing all this, you should feel like, wow, I think you have a pretty good understanding of what's happening. You haven't done anything about it, but I have hope that if you can understand what's happening pretty clearly and accurately, then we can actually do something with it. And I kid you not, this is kind of wild to say, but a lot of therapists that I talk to, their main focus in those first couple of sessions is just simply to provide a warm and safe, welcoming environment, which is fine. That's good. That should be like a baseline. That should not be the goal of the first couple of sessions, right? Because you actually need to accomplish something, which is the gathering of accurate information to understand correctly what's going on, the nature of the problem and the symptoms that the person is experiencing, so that you can develop a plan to treat all that stuff. So a good therapist is going to gather all that information correctly, and hopefully, by that, you feel understood, you feel seen, and like this person cares about what's going on because they've done a good job collecting that information.
Yeah, we're going to do a different episode on this, excuse me. But one quick side note here is that most of the time, and this, I've been in sessions where what I'm going to say next is not true. It doesn't work this way. But most of the time, as a therapist in that introductory session, you actually are not providing much empathy at all. Because what you're trying to do is get to know what's actually going on. And simply put, if this person's like talking about some stuff that's hard for them, obviously, because that's why they're there, and they don't really know you, and then as a therapist, you go like, oh my gosh, that must be so hard for you. Then they're like looking at you like a space alien, like, okay, this is really uncomfortable. I just wanted to let you know these things. I don't really know you. I want to see what you think about them before you go into the heart of things. So anyway, we'll get into more of it later. But the idea is that you are developing an understanding. And as a client, if you are uncertain after a couple sessions, because I say this because if you are uncertain, it might mean that you haven't quite got the rapport that you need necessarily. So if you ask the therapist after 2 or 3 sessions of being uncertain, and I would wait, honestly, I would wait probably till about maybe even the 3rd session, because it kind of takes that long sometimes to build rapport. Just ask them, hey, what do you think? What's your understanding so far of what you think's going on, just big picture wise? And they should also, if they don't have to know everything, but they should kind of know what they know and know what they don't know. Like, I feel like I understand this if I'm clear on this, blah, blah, blah. Yes, you are. Okay, so to me, I think where we need to go is X, Y, Z, that kind of thing.
And I would even say at the end of I try to do this at the end of the first session after they've, given me the information, or maybe after a couple of sessions, because maybe it's taken a couple of maybe a follow-up to kind of get through everything. But I will try to reflect that back, like, okay, here's what I'm understanding. It sounds like you're coming to therapy because this has happened, and you're experiencing these kinds of symptoms, and you're hoping to, to accomplish this, or you want to be over in this place instead of right here. Is that accurate? So if your therapist can summarize pretty accurately like that and reflect that back to you, and you feel like, wow, you've done a pretty good job of connecting some dots and identifying the major themes here of the problem that's going on, or the symptoms that are happening, if you feel like the therapist can do that, that's quality therapy. That's an indicator that the therapist has done a good job listening.
The other piece of that is the use of interventions. So if you feel understood, the next kind of question is based on, so it's not on the therapist to quote unquote fix you. Okay, let's just get that out there. You're not, this happens a lot where people are like hanging on a thread to make, over exaggerate on like, what is the therapist going to say? He needs to give me, or she needs to give me a big epiphany, and then everything's going to change. Like, if they just say, oh, that's what it is, the secret bullet, whatever. Okay, that's, every once in a while that actually can be a thing, but that's not a regular thing. So what you need to do is understand or believe that you and the therapist are matched in the direction you're going. So as an example, if the therapist is like, okay, what I think you probably need to try this week is to be more assertive, to be more vocal about what it is that you feel, because it sounds like that you struggle with that. So maybe try to do that once or twice. If you in the session are like, that sounds good, then you walk out the door and are like, maybe a day later, and you kind of try in your head, but you can't do it. Like, you don't do it. And then as part of the issue, when you come back in, you also don't want to say that because you didn't do anything, and what can happen at that point that kind of makes it difficult is if you just start trying different things without really going back to understand why the first thing didn't work, which honestly I get sucked into that sometimes. I'll start like the person will say like, oh, either they didn't do it, or I'll get the sense that like, okay, they're not doing it. I'll start thinking about other things, alternatives, and really I've skipped a step, because if I can understand what's not working, why the match of the intervention isn't going, then we can adjust it actually.
And that can be like, good therapy would be a therapist would, and it's not that they gave some advice or some intervention of like, hey, try this. That's not necessarily the problem. Although I would argue that if a therapist is consistently saying, try this, do that, try this, that might not be the best approach, right? Because there's this step that you're describing, Nathan, which is, okay, try this, and then if the person doesn't do it, or if it doesn't work for some reason, a good therapist in good therapy would say, okay, let's talk about this. What happened for you? Why did that not work? Or what was difficult about it for you? What came up for you in that process that made it not successful? And that therapist is listening to understand kind of the mechanism or the reaction that was going on better understanding the inner workings of the person with that potential intervention to see, well, maybe they're not ready for action yet. Maybe the person has some like internal emotional things that they need prior to taking a step. And so that therapist might need to adjust and work on some internal stuff before they give them some behavioral stuff. Or maybe there's the client misunderstood, or they thought it looked a certain way and they realized, oh no, you don't have to do that. And they were like, oh good, because I just don't want to be like my dad. And I'm like, oh, I see. So like there's some work that might need to be done together to figure out like what does the client really actually need, and how can the therapist best find that need and meet that need in that person, but also to help the client know and understand their own needs more and more and more to empower them over the process. Because ultimately you don't want to depend on your therapist, right? So good therapy does have a period where you might depend on your therapist for a time, because you don't know, you don't understand, that's why you're going to therapy in the first place. Please help me. But over time, the hope would be that a good therapist is empowering you as a client to know and understand and take care of your own needs.
So I want to give you a visual. And what in the beginning of what Aaron was talking about, hello, my words are not working. And what I was kind of saying at the end there was this idea of, okay, we got to figure out why this intervention isn't working. So what happened actually in that moment is the therapist is getting stuck with the client. And that's actually good when you intend to do that. So here's a visual. Somebody, they're rock climbing, and one person falls in a crevasse. Okay, and the person comes over to help. And so they make a suggestion, hey, can reach your hand around to this other part. And the person's like, I can't do it. And so the question is, can you actually not do it? Or are you afraid to do it? Is there a reason why? What's the reason why you can't do it? And then the therapist realizes at a point, like this helper realizes at a point, oh, you actually can't, your other arm is actually really trapped. Like you actually cannot move your arm. Okay. So this kind of becomes a thing where now it's this two-part, like the one person trying to get unstuck and the other person trying to help them actually get unstuck. So the other person that's helping has a different vantage point, right? They can say, reach up to your left. Well, the person might be like, I don't know. Like, no, you actually can. Your left arm looks fine and you can't see it, but this ledge actually is totally solid and there is actually a handhold there you can grab. You just have to trust me, right? So in that moment, there's some dependency, but all the effort's on the person that's stuck, right? And so now if you are in this crevasse for 9 months, you're dead, you know?
Right, and hungry.
Yeah, like that's
Very
what I mean, because you got to eat. If the therapist is now feeding you like a little bird, you know, you're there forever. Anyway, so there is you should get some movement to getting unstuck is my point. But anyway, that visual just kind of came to me as like, okay, this is kind of an imagery of what therapy is.
Yeah, that's a really good one. And I like it, especially because there are these different vantage points, and over time, you know, the client, the one who's actually doing the work, does learn that I can try things and it's okay. I can put my hand here and see if it can hold, because I have seen certain things and thought it won't hold, but my therapist is like, nope, you can put your hand there. And sure enough, it does hold when they didn't necessarily believe that it could. So they learn actually how to trust themselves. You as a client want to actually learn how to trust yourself more and more. So I love that visual, because I think it's very much empowering to the client, and it's teaching the client that actually you know a lot about your own needs and your own healing process more than you might realize.
Well, the other piece of that too, not to interrupt you, but is the idea it is a actual working dynamic. So you don't necessarily, I mean, think of it this way, you don't necessarily sit there and go like, so, you know, how are things? Like, I think they suck, bro. Like, I'm hanging and I feel like my blood circulation's cutting off, right?
So that kind of leads me to another point. Like, sometimes people will come in and they don't really know what to talk about, right? A good therapist will actually teach you and train you on what to look for and what to focus on. So there are some people that will come in and they'll just talk about, you know, this is what happened during the week. And it's my job as a therapist to ask the questions that I know about them, what they came in struggling with. Like, okay, so this is all going on. what's been going on inside with your anxiety? Or and I know this is with all this stuff, this has been a time where you might become very impulsive, or you typically or historically have returned to these old coping habits. How has that been for you? So a good therapist has taken the conversation from, this is just stuff that's going on this week, which is fine, but it's not really helpful for therapy necessarily. A good therapist has dug in between that and found kind of the common thread that runs between sessions or in your life that is causing these problems, and they've brought it to your attention and put it in front of you to say, hey, let's keep focused on the actual issue for what brought you here to therapy. And the hope would be that you learn that if you're a client over and over, like, oh, these are things that I need to be looking for. And it's always weird to me when people do this, but it's effective, right? People will come in and they'll tell a story about this is happening, and then I heard your voice in my head. And inside,
so weird.
I cringe a little bit.
I'm
like,
oh
every
no,
time. Please.
I just heard that this week.
Right. Seriously. It happens like all the time. But it's cool because when the person is saying that, often they're like, I know that you've told me, like, trust yourself, listen to your intuition, don't people please, or whatever the thing is that I've been saying over and over. That person now has learned, I've kind of conditioned them on what to look for and how to think through things. Now they have it for themselves. And they do that, and it's like, wow, great job. You've learned over the course of this therapy that you actually can listen to yourself or trust your intuition or whatever the thing is. That's great because you were empowered to do this without me.
Yeah, as we close up here, just want to say, this is probably going to be a bigger issue, but I'm just going to say it anyway. There are people that kind of just need to process outside of their system, right? And they will use therapy to do that. And that honestly looks a lot like, to anybody else on the outside, look like, well, that's kind of no big deal. You're going to pay for that. The answer is, yeah, they are, apparently. That's what they want to do. There's therapists that are totally okay doing that and processing that stuff with them. And then there's therapists that don't want to do that. And that's totally fine. What should happen is they should actually talk about that at some point.
And let me say, a good therapist will recognize it and say, you know what, I'm not the best fit for you.
That's exactly where I'm going. Is after a while when the therapist is kind of realizing, like, oh, you talked about processing this, and that is actually the end. Like, you don't necessarily, because there are therapists out there that really intuitively, and it's all based in personality, they need to be productive, right? And that's good for you. That's very good for you. And if they know that about themselves and can speak to it, that is good therapy. To just telling you, like, hey, and giving you a referral to some person they know, like, oh, Nate loves to hear the drivel that you got going on. Call him. Anyway, so I just wanted to put that out there.
Yeah, and just one last thing. I think also good therapy is checking in, where the therapist is checking in with you. Hey, how are these symptoms going? Where do you feel like you're at in terms of your progress? Do you feel like this is still effective? Do we need to make changes or adjustments? Maybe at a certain point, they're like, hey, how are you feeling about the work we're doing here? Do we need to take a break?
Right.
Or if we've been working together for a long time, do you feel like this is still effective? Or do you need to take a break from me? Or maybe you need to work with someone else to get a change of perspective and a different style.
Right.
A good therapist, I think, will bring those up and talk about those, because those can actually be really effective interventions for helping a client continue to make progress. Because that's, again, overall the goal.
Right. So the long-term nature of processing sometimes can be to where the person likes the process. They don't want to give that up. But it's also simultaneously not quite as productive as they need it to be. They want more intervention, but they also kind of don't. They don't want to sacrifice their process time. So the therapist needs to be able to intervene in there and say, like, look, we can figure out a way to do both. Let's look at a compromise that can unstick you in this scenario and still give you the ability to process things as you go. So we're a little over because we are. Have a great day.